Hello, good evening. My name is Dr. Chudi of Snowspirations Global Health Solutions. And this evening is our much awaited Open Clinic with Dr. Chudi on YouTube. Today is a good day. And today we have a double celebration in our community. So we have a 36-year-old lady that recently got married. And from what she told us, this is our first time in relationship. This is our first time in having sexual intercourse. And she's so excited. She's 36. Her partner is 37. And they are asking for the best way they can become parents in 2024. Now, this is something that everyone out there should be looking forward to. For every intending mother, for every intending father, there is someone out there that God placed in your path. And when both of you are a tag team, you will start your family. I actually feel better when I get some questions, some concerns that some people will think is funny. There is nothing funny about this case. A case of a 36-year-old who is just having sexual intercourse for the first time. She got married in May last month, and she's been practicing pretty much everything I've been teaching, which is very comforting because sometimes when I show up and I talk for hours, it feels like I'm not communicating. But I'm so happy she understood the concept of PPP, and she's actually practicing PPP. Remember the concept of PPP. The first P is praying. We pray a lot. We believe in God. The second P is playing. Playing simply translates to regular lovemaking. Now, the other P is practicing, putting everything we teach you into practice, getting consultation, getting the help you need. So I'm so happy that this lady was able to practice and translate her PPP. Now, let's get down to the major meat for today's events. So at 35, this lady has graduated into advanced in maternal age. So that's very significant. So she's currently 35 going to 36. So I know she's been worrying about all my teachings about advancing maternal age. So what happens when you get to age 35 to women? The way God structured women and men are entirely different. If a woman gets to 35, what happens to what we call her fecundity, her ability to become pregnant and bring forth a baby? That's called fecundity. What happens to her fertility? At 35, what is the most important test we have to run for this couple? Number one, the very most important test, we have to check the ovaries. We have to look at her ovarian reserve test. Thankfully, she's still a newbie in sexual intercourse, so the possibility she might not really be exposed to chlamydia and gonorrhea is limited, though there are a couple of other things. So in as much as you've not had sexual experience, especially penetrative sexual experience, if you expose yourself to any male partner out there and there is contact with the penis and the vagina, in as much as you've not experienced penetrative sex, you've actually exposed yourself to likelihood of picking sexually transmitted infection. So we have to first of all encourage this couple to go for pre-conception visit. So find a reliable gynecologist, book an appointment, and go for a comprehensive health check of the woman, focusing on this internal reproductive system. So the lady has to get an appointment with a qualified gynecologist. When you get an appointment with a qualified gynecologist, we are going to ask you a lot of questions. When we are done asking you questions, we will examine you. When we are done observing you and examining you, we can examine you by touching vital places to see where you stand. When we are done with the examination, we are going to ask so many pertinent questions: medical history, surgical history, gynecological history, family and social history. When we are done, we are going to send you for some specific fertility investigations, including your hormonal assay, your HSG, your ultrasound, and checking your BMI and checking other parameters. Now, we're also going to check the partner. So we don't know the partner's experience. We don't know if the partner is also having intercourse for the first time, but we're going to have a critical look at the partner. Now, once we are done with that, we will encourage the lady to immediately start taking her prenatal multivitamins. At the point she's taking her prenatal multivitamins, she's already playing the role of a mother, because your prenatal multivitamin is to plug the holes of things you're not getting from your food. So I would strongly encourage you to start taking it immediately until you have your baby in your hands. Now, you have to modify your lifestyle from bottom up. You have to make sure you're getting at least 7 hours daily sleep. You have to make conscious effort to stop drinking soda and alcohol. Soda and alcohol are brothers and sisters when it comes to fertility. You don't need any of them. You have to make conscious effort to stay active at least for 30 minutes every day. Now, when you're done doing this, then you have to hang out with positive-minded people. Of course, you have to consolidate on your second peak, which is regular lovemaking. Now, because you're now 35 going to 36, your criteria is 6 months. So since you got married in May, this is June. So we're going to run you till December. If you practice your PPP religiously, you're praying to God every second, you're making love every 48 hours. If you guys love it so much, you can make love every day, that's okay. So by the time you have done this consistently for 6 months, so you're no longer going to be 12 months, because 12 months is below 35. You are now 35 going to 36. So for 6 months, without using any contraceptives, and you guys are fully together, and you guys are a legal team, you guys are together, you guys have a tag team, invite your partner in this place, then continue practicing your PPP until December. By the special grace of God, depending on your cycle. So I don't know if you're regular. I don't know if your cycle is between 21 to 35 days. I don't know if your duration of bleeding is normal, which is from 2 days to 7 days. I don't know about your partner. I don't know your body weight. I don't know your BMI. So these are factors that will help us to pinpoint if you're going to be pregnant faster than estimated. But the possibility of you becoming pregnant naturally is very high. And as of this moment, that's the only option left for you. I'm not going to tell you to take any other drug because you don't need them. You just started. You just got married in May. You're 36. I understand that. So your cutoff point is 6 months. But there is no need to tell you, to go and take this fertility drug, to go and take that fertility drug. We cannot say you're having infertility now. So I want you to stay focused. I want you to continue on the same track. And I want you to find joy in your lovemaking. You see, we are in a society that shame and stigmatize lovemaking. God initiated lovemaking for a purpose. Let me tell you how. There is a reason why a woman will have increase in libido when she's ovulating. If you monitor lower animals, have you seen where the male partner is actually following up with the female partner? What do you think happens? What do you think happens when you see a cock pursuing a hen? Because that particular cock is on heat. What do you think when you see a he-goat pursuing a she-goat? Because that she-goat is on heat. It's the time she's ovulating. So God has planned everything to the minutest details for lower animals. How much more us? So there is absolutely nothing, criminal or nothing wrong in making love and loving your lovemaking, especially if you have to make love every 48 hours. So you have to acquire that knowledge. Now, I know you've just started, so there are so many things you might not really know. Both of you will make sure you guys indulge in finding out what you guys love, what you don't love, what your partner loves. Just pretty much relax. The truth is, you won't even know when you become pregnant. You will blink and you're pregnant. So that's pretty much what you need to do at this stage. At 35, going to 36, I'm just gonna say congratulations. Your prayer has been answered. And you told me since you started following me, you've lost hope. Because, depending on the society where you live, there's a particular age a woman will come to, and her mother will start putting pressure on her. Her father will start putting pressure on her. Her siblings, the pastor, everybody in the community will start putting pressure on you. So you can see a lady that was previously worried, loss of confidence, because probably everyone around her is married and they begin to compare each other. But she was able to imbibe the daily teachings in this group, and she was able to take her booster, because the problem is, there are so many marriageable single ladies out there, but they are going to the wrong places. It's not only in the church you will find a partner that will love you. You can find your partner anywhere, in any social gathering. There is absolutely nothing wrong in doing that. So, but if you limit yourself to only people in your community, only people in your church, the person in your church might just be thinking they're doing you a favor. But there is always someone out there that will love you the right way. But you have to place yourself in the right position to be found, and you have to also be ready to open up to explore. Life is a risky venture, so you can't figure so many things out. But you have to be smart. You have to have a smart objectives. You have to have a specific, measurable, accountable goals, which you can measure. Now, for you, by the special grace of God, on the 20th of June, 2024, you will have your baby in your hands. And by the special grace of God, you guys can even have multiple pregnancy because you're now in the advanced maternal age. So in as much as you have fewer eggs and quality eggs, possibility of you having twins, triplets, and quadruplets is increased. Okay, so that's my quick feedback in that regards. Now I'm gonna sit back and I can see my COO, amazing lady, also in attendance, always available to help. So we are gonna give ourselves an opportunity to learn. So in the next 10 minutes, please feel free and ask all your questions. Remember the case we are dealing with today. A 35-year-old lady going to 36 who recently got married last month, and she wants to look at the options that will help her to become pregnant as soon as possible. That's what I've been explaining. So please quickly hit me up, ask all your questions. COO, please. I need all those questions you normally craft. I know you don't need, the particular topic, but please help. Let's keep the clinic going. So guys, if you're out there and you're hearing my voice, this is your opportunity to ask me questions. Immediately after this clinic, I'm going to go to our Facebook page. I'm going to repeat exactly this topic. So if we have limited audience in YouTube, it's okay. We're going to go to Facebook. We're going to spend another 30 minutes. Remember the event coming up on Sunday, the 25th of June. We have a special masterclass on fertility. Male fertility, female fertility, primary infertility, secondary infertility of unknown origin. We are going to tackle all of them. So if you are having delays, we invite you to come, let's fellowship. And by the special grace of God, you will become. But right now, guys, please ask your questions, straightforward questions. I'll provide you feedbacks. Start asking your questions, please. Do you have any questions? Any question whatsoever, even if it's not related to this topic, feel free and ask in real time. Okay, you're 39 and your question is not complete. How should a woman advanced maternal age prep herself for motherhood even before marriage? The moment you realize that in the future you're going to be a mother, you have to modify your life. Like, you have to actually take time and study your reproductive system. So what do I mean by that? You have to have a diary. You have to learn about your cycle. So your cycle is the interval between your 2 bleeding months. You have to learn about the number of days you bleed. You have to know your normal. Then you have to adopt a healthy lifestyle. Daily exercise for 30 minutes, avoiding your soda, drinking a lot of water, avoiding stress, getting about 7 hours sleep, going easy, hanging out around with positive people, taking your prenatal multivitamins. Matter of fact, singles are also encouraged to take their prenatal multivitamins. So once you get to the age of marriage and you're looking for a relationship and you really want to settle down, that's the time you have to start fortifying your food with prenatal multivitamins, because the possibility that when you will wait before you see your partner and you start actively living healthy and you might not really have adequacy of the folic acid is very important. So as soon as you have this already streamlined, make it a point of duty to start making changes every single day. Now you have to bring out one day every year to go for your well woman check. When you go for your well woman check, we're going to check the totality of you. We're going to keep an eye on a couple of preventive measures that will help you to thrive. Then you're going to be very cognizant of your family history. So if your mom had any form of cancer, if your dad had cancer, if your sibling had any chronic condition, cancer, diabetes, hypertension, you have to be on the lookout for developing them, because whatever you have in your family can happen to you. The same thing is applicable to the man, okay? Very beautiful question. I love that. You are 39. You are looking to conceive for a baby boy. You are currently 7 ppp. When is safe to go again? Now, I'm going to explain this so you will understand. You see, there are so many postulations out there regarding gender selection, especially around the concept of ovulation. A particular time to make love to have a baby boy, a particular time to make love to have a baby girl. But guess what? It's flawed. It's not reliable. It's not accurate. Why is it not accurate? Because we cannot say for sure that this is when you will ovulate. So possibility you're going to get it wrong is very, very high. It's actually called the Shetto's method and a couple of other methods, Billings method and all that. But we don't preach things that don't work. So I cannot promote timing a particular lovemaking section to get a particular gender. I don't do that, because possibility you're going to be disappointed is almost 90%. So what will give you a particular gender? You go to a fertility specialist. We take time and we structure the eggs and the sperm to an extent of selecting carefully the sperm that will yield a baby boy, a baby girl, through a special process of IVF. This is the only method that will reliably give you a particular gender. Any other thing you're practicing, the possibility it will fail is almost 100%. Okay? Do the same 18 months rule between pregnancies apply to women of advanced maternal age? I love this question. Let me tell you why. When you get to advanced maternal age, we don't have much time, especially if you're in your 40s. So we might not have that 18 months. Remember, generally, we advise women to allow 18 months for their body to recover before becoming pregnant after childbirth. But if you are above 35, we are gonna customize your own management. So customization means it will be individualized. Let me give you an example. If at 37, we check your ovarian reserve and our anti-malarial hormone is not really encouraging, we're not gonna waste 18 months. We're gonna gradually monitor your recovery. Then as soon as we are okay that you're fully recovered, we're gonna encourage you to go for pregnancy again. So the older you get, the possibility of allowing 18 months will be limited. But 18 months is highly recommended if you are below 35, because the younger you are, the more the possibility you can become pregnant faster. So it's not a one-size-fits-all. So assuming you're 45 and you succeeded in having a baby through IVF, of course, when you deliver your baby, we're not going to wait for 18 months. We're not even going to go beyond 6 months. As soon as we're okay that you're good and you want to have other babies, we're going to go in. Now, some women might not be able to have another pregnancy. Some women might need to go for surrogacy, or some women might need to go for adoption. So whatever works for you is what we will do better. They will still use you based on your potential. So the outcome of your anti-malarial hormone, the outcome of your ovarian reserve will determine how soon you can become pregnant. Very important, okay? I love those questions. COO, please keep them coming. How long after fibroid surgery can one start trying to conceive? First of all, we don't try to conceive in this group. We believe and we actually conceive. Now, there is no general rule of thumb regarding when you can, but we always want you to recover fully before going for another baby. Now, from global perspective, 3 months is normally recommended because we want you to have had your bleeding 3 times. So you coincidentally will have 1 bleeding per month. So we want you to have seen your period 3 times before you begin to, plan to see if you can become pregnant. However, it's individualized. So if you had fibroid surgery at 45, we might not really waste time. So once we know that you're okay, you're fully healed, we might start as soon as just from 4 months and up. But if you have age on your side and we want to make sure you're fully recovered, we're going to beat time. So your time to go again will be dependent on your individual case. So meet up with your doctor and your doctor will tell you exactly what you need to do. Okay? Zero James, thank you so much. Good to be here, correct. Thank you for coming back. Priska Obinodo, what if you had the baby via C-section? Would it be safe to conceive again after 1 year? 1 year is 12 months, right? Now, remember, the 18 months is applicable to vaginal delivery. Now, when you compare vaginal delivery and cesarean section delivery has more risk factors. in regards to recovery, because your normal process of delivery is actually how God wanted it. But cesarean section delivery is an interventional delivery. So it will take you more time to recover from CS compared to recovery from vaginal delivery. So 1 year is gold standard. Then you add extra 6 months to get 18 months. So it's still your doctor that will determine, especially if you have had CS. There are some women that once they have CS, all their subsequent deliveries must be CS. There are some other women that can still have vaginal delivery in as much as they've had CS delivery in the past. So your case is also customized, okay? All right. What's my take on a single woman of advanced maternal age opting for IVF treatment without a partner? I support it 101 and 1000%. You see, I'm a maternal and child health specialist. So whenever you see me in this world, I keep every, idiosyncrasies, I keep all my religions at bay. There are certain things I believe. There are certain things I practice, but we subserve to everybody. Now, I believe that any woman out there who desires to be a mother should be a mother. That's my belief. That's a maternal health concept. So if you know that your life will be complete, that you will find the joy you're seeking, and for some reasons you had a broken relationship or you've not seen your pattern, but you know fully where you're able to take care of a baby and bring a baby into this world, why not? It's an option. Because guess what? At the end of the day, we're going to get old. Now, if you strongly desire to share companionship with your kids when you get old, who will look after you when you're old? Who will you have this bond with when you're old? So I personally believe that if a woman is out there, whether divorced, whether single, whether separated, whether whatever, it doesn't matter. If you want to be a mother, go for it. There are so many ways you can go for it. You can actually have your baby alone. You can go for donor sperm. You can go for surrogacy. You can go for adoption. Your baby will be your baby 100%. But please, depending on the location where you live, find out what the legal system there says about your process. But I strongly support you having your baby any which way your status is. Do not wait for the society to define you. Then at the end of the day, you're miserable, you're depressed, you're sad because you wanted to conform to societal standards. Define your own objectives. Define what makes you happy. At the end of the day, you will be the person that will stand in the throne of grace. So if babies are going to make you happy, why not? Go for them. Okay? All right. Do you guys still have any questions? I actually love the questions from COO Zero James. Everyone in the clinic now, we have quite some good numbers, 11 people. Very important topic. This is a place you can open up. This is a place you can ask the hard question. And if you notice, I'm a very liberal provider. I don't stand on anybody's way. So long as you need help, I'm going to give you help. Because having a baby changes everything. The relationship you will have with the baby you're believing to have now, they have not defined it in any dictionary. The role of a mother is ordained by God from birth. If God didn't want you to be a mother, God will not make you a woman. So it's something that is promised you. It's your blessed assurance. So if you want to, you have to go above and beyond. So many people are wasting time. So many people are doing the wrong thing. So many people are praying empty prayers. So many people are taking the wrong advice. And before you blink, it's all over. This is true. So don't delay. If you're in a toxic relationship, leave immediately. So many people believe, oh, once I'm divorced, once I'm separated, I will no longer find love. Who's telling you that? This is 2023. There are so many single men who will easily marry you, whether you've divorced for 20 years. They look out for the character in you. It's not whether your breast is pointed or your shape is this. We don't care about that. We care about the core character, regardless of the number of babies you have. I'm keeping it real. This is what this is the era we live in. So don't worry about what's going to happen when you walk away from a relationship where the guy is abusing you, is toxic, is even hitting you physically, which you're not really bothered much about, compared to the emotional trauma. So if you're in a toxic relationship, if your partner is not on the same page with you, personally leave. There is someone out there who will love you the right way. Have an open mind. Don't think it's all over. Don't go and place your whole hope on one Homo sapiens. There is nobody that has the key to your happiness. When God gives you life, when God gives you the knowledge, the difference is the knowledge. Because at the end of the day, the people that will give you the wrong advice are the people that will still criticize you on your dying bed. That's the truth. Most women are not pregnant today. Most women are not mothers today. Most women are sad and depressed because of the advice they took from their mother, because of the advice they took from the wrong people. And when it's late, they will start doing what they would have done 20 years ago. But I'm challenging you to change your ways in this group. This is where we differ from so many people. We tell you the truth, then what you do with your truth is up to you. On a medicated cycle, the month, and on CD10, saw your fetus mucus, can ovulation occur sooner before cycle day 14? Now, what you need to understand in our group, we don't necessarily, go waiting for a particular day to make love. We don't do that. So we don't time our lovemaking. Now, the criteria for your ovulation is based on the regularity of your cycle. So first of all, I don't know your cycle. So long as you have a regular cycle of 21 to 35 days, once is regular. So regularity means if you start from January and you know that every 30 days or every 29 days or every 28 days or every 27 days you bleed, then you have a regular cycle. So let me give you an example. January to February, 30 days. February to March, 29 days. March to April, 28 days. April to May, April to June, April to May, 30 days. Is it regular? Yes. How? You find the average. So when you have that regularity, if you apply factor 14 to that average, you will get. So your average should be giving you about 28 point something, which approximately will give you 29. So if you minus 14 from 29, then you can have an approximate date you will ovulate. Now, there are a couple of other things we can use to monitor if you're ovulating. We check your day 21 progesterone. We can track your follicles. We can use other advanced methods to see if you're ovulating, especially if you're having challenges. So if you're having delays in becoming pregnant, please, no timed lovemaking. Every other day lovemaking is what is highly recommended. Very important. You cannot say I didn't want you. So if you used to make love because you feel you're having your cervical mucus and you're so convinced by Amadi or that you're ovulating, stop that, because you don't know if you're ovulating or not. What are you supposed to do? So long as you're not bleeding every other day. Like tonight, if you have not made love yesterday, I encourage you to make love today because you can become pregnant tonight. Okay? Do you have gender selection clinic? We don't, unfortunately, if you're in London, what we normally do, we normally organize master classes. We've actually had one gender selection masterclass for 2023. Hopefully, we might repeat another one before 2023 ends. But what I will tell you, make sure you register for the upcoming fertility conference. We're going to cover this. We don't really have limit in our fertility masterclass on the 25th. So go and register for that. But because you live in London, you're not qualified for a consultation. You have to be resident in Nigeria to be qualified. Okay? All right. If you want to travel to Nigeria to get any help, then please plan with admin. Once you enter Nigeria, you're qualified. But so long as you're not in Nigeria, you're not qualified. Then you can attend the masterclass. Masterclass is open to everybody. All right? So do we have any other question? We have about 2 minutes. Actually, a very productive clinic this evening. Remember to join me in Facebook immediately. We're going to knock off this topic. Then we're going to, if you are very interested, then join us. Are you in our Facebook page? If you're in our Facebook page, follow me immediately after this clinic. Admin will share the links. Priska, be a dual. There are so many women that have been promising they will use mouth to kill lions since 2015. They still show up to 2023. So if you think you are not serious, don't even bother. But if you're serious, follow admin. Admin will help you in the best way she can. All right? So admin, if you give me a signal, then we can exit and plan for our Facebook. And after that, our Facebook name is still the same. Hold on, let me see if I can copy our Facebook page. Just give me 1 minute. I'm just trying to help you the best way I can, okay? So give me 1 minute. All right, so I'm going to type the link to our page. It's just going to come in now. So click on that and join us immediately after this clinic ends, okay? That's our clinic page. in Facebook page. Okay? All right. So we currently have an advert running on this particular video. Once the advert is over, it will be approximately 30 minutes. Then we can take our leave and we can start heading to Facebook. So thank you so much for coming. Admin, thank you so much, Kenneth. Thank you so much. Guys, please join me in Facebook immediately so we can continue. Thank you so much and enjoy the rest of your evening. Until I see you, God bless you. Bye-bye.